Professional athletes are prone to labrum injuries due to trauma to the shoulder joint. The labrum also becomes more brittle with age and can fray and tear as part of the aging process. The pain due to these injuries can often cause professional athletes to watch from the sidelines as their body properly heals. Today we visit Dr. Michael Meow, sports medicine orthopedic surgeon, to tell us more about labrum injuries.
Labral injuries are an injury to the lining tissue of the cup in the shoulder joint. The liner is an attachment for the ligaments that hold the shoulder into position, as well as the biceps tendon. Injuries to the labrum occur with three different basic types of mechanisms. One is repetitive throwing or overhand sports, such as serving in a tennis match. The second is an eccentric load or a pulling of the biceps, as in lifting a heavy weight or trying to pull an athlete off position. The third is a blunt trauma, where you actually jam the shoulder in some fashion or direction. The symptoms of a labral tear include pain, popping, generally inside the joint. When you load the biceps or try to reach or lift heavy items, it will hurt. The treatment for labral tears, if it is symptomatic enough, usually requires some type of surgical debridement, where you remove torn tissue, or repairing the liner back to the glenoid itself. Athletes that have this injury will have some difficulty returning to play if they are a dominant side arm in terms of a thrower or a racket sport. High loads in terms of pulling or pushing, they may also have difficulty playing.
The treatment of the labral tear in rehabilitation is treatment of the shoulder, getting the range of motion to be equal in one direction and the other, kind of balancing it out. Again, rehabilitating muscles that are imbalanced. Again, muscle imbalance to me is my definition is certain muscle groups become tight in a state of dysfunction and certain muscle groups become weak in a state of dysfunction. So what we want to do as rehab specialists is to balance that out. Strengthen the weak muscles, possibly stretch some of the tight muscles and gain that full range of motion that the overhead throwing athlete usually needs. This is a good place to start because sometimes it's so painful to lie on the shoulder that you can't actually get on top of it. So as you notice, Dave is kind of angled off the shoulder a little bit, and the arm is not quite up to 90. It's like halfway, about 45 degrees away. And you're going to take this hand, and Dave is stiff right there, so he's going to feel it. You feel a stretch right there, right, Dave? In the back of the shoulder, and you want to hold that position for 30 seconds on, 30 seconds off, and you want to do it 4 times. And you can accumulate during the day. If you do it 4 times during the day, you can accumulate about 15 minutes worth of static stretching to the posterior soft tissue structures of this left shoulder. Now, when you get more advanced, you might want to take it a little bit higher up to 90-degree angle. Do the same thing. And now Dave is going to lie directly onto the shoulder and then do the same stretch, and you feel a good pull in the back of the shoulder. If you've been released and your physician is giving you the okay to go start using weights, then we have 2 exercises that are excellent for strength training the shoulder. One of those is external rotation, and the other one is horizontal abduction. We're going to cut to those right now. So you're going to put his elbow on his knee, and we're going to slowly lower it down, controlling the fall, and then come back up. So that's external rotation, right? And goes out to here, and he slowly lowers it down, doing the eccentric loading to these posterior muscles back here. And again, we want to find a weight. We can do what? 5 or 6 or 8 times. Progress to 2 sets. We progress to 3 sets of 12 or 15 max. So 3 sets of 15 is max. If you can do that with no problem, you drop back down to 6 or 8 and add more weight. Always challenging the muscle to build back stronger. When we exercise, we tear down muscle, we want to build it back stronger. And labral tears, again, is not an easy rehab process, especially post-surgically. That's going to take at least 6 months before an overhead throwing athlete is going to get back to throwing following a rehabilitation of a surgically repaired labrum.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with SportsMD.com. Remember, at SportsMD, health equals performance.